One Health disease surveillance relies on integrating sensitive personal data, such as medical records, genetic information, and location data, across humans, animals, and environmental sectors. While this integration improves early detections of emerging disease and antibiotic resistance, it raises serious ethical concerns regarding data privacy. Furthermore, advanced data linkage and cross-border data sharing increase the risk of re-identifications, unauthorized access, and surveillance overreach. On the contrary, vulnerable and marginalized communities may face disproportionate monitoring, which can worsen the social inequalities and erode public trust in One Health initiative. Therefore, this study aims to analyze the ethical implications of data collections in One Health surveillance, identify strategies to balance the public health needs with privacy protections, and examine equity concerns in surveillance implementation. Addressing this issue is significant because strong data governance builds public trust, prevents discrimination based on health or location data, and ensures compliance with frameworks such as GDPR.
Privacy-enhancing technologies is one of the strategy. It enables secure cross-sector data sharing for research, disease surveillance, and personalized medicine while protecting sensitive health information. It also trains AI models across decentralized data sources without sharing raw patient or animal data. A real-life example is hospitals and research institutions use privacy-enhancing technologies such as federated learning to study patient outcomes without sharing raw medical records. This approach allows models to be trained locally, improving diagnostics and treatments comparisons while maintaining strict data privacy. There are three SDG aligned with this strategy, which are SDG 3, 9, and 16. For SDG 3, it aligns by building AI models for diagnostic and personalized medicine without exposing real patients' records. As for SDG 9, it unlocks large data sets, driving innovation in smart cities, fostering digital infrastructure. Lastly, for SDG 16, it ensures transparent government by enabling secure sharing of public data, and it builds trust with one another.
In One Health disease surveillance, ethical data use is essential. Strategies like a unified data governance framework and independent ethical oversight ensure data is collected and shared responsibly. For example, anonymized COVID-19 data track infection trend without revealing identities, and ethical oversight in avian influenza surveillance protected farmers' privacy. This approach support sustainable development goals. SDG 3 breed trust and ethical health monitoring, SDG 9 strengthen secure digital health, and SDG 16 promote transparency and accountability. Together, they show how One Health balance effective disease control with privacy, public trust.
From an environmental perspective, secure health data allows early detection of diseases like Nipah, which helps prevent zoonotic spillover and protects nearby tribal forest ecosystems supporting SDG 15 life on hand. However, if sensitive data is leaked, disease hotspots can be exposed. This may lead to increased deforestation by up to 20% and even displacements of local communities. To ensure justice, community consensus is essential so benefits are shared fairly and ethically. In terms of public health, anonymized disease surveillance encourages reporting, especially in vulnerable areas such as leptospirosis hotspots, increasing reporting rates by around 20%. This directly supports SDG 3, good health and well-being. On the other hand, data breaches can cause stigma, particularly among poorer communities, delaying outbreak response by 15 to 25%. Therefore, applying ethical privacy by design approaches is crucial to protect health, equity, and align with SDG 10, reduce inequalities.
Secure data storage can have positive impact on the community. First, it helps to rebuild the community trust and improve disease awareness by encouraging greater community participation in testing and data collection. Furthermore, secure data storage can reduce stigma among minorities by preventing discrimination by employer or insurance company based on health status. Lastly, it promotes health equity by ensuring that the data are not used to train bias algorithms, thereby protecting the community from systemic discrimination. In addition, the economy can also benefit from secure data storage. It helps maintain economic stability by preventing data leakage that could cause market panic. Workforce productivity can also be improved as this project helps prevent disease outbreaks that may lead to large-scale workforce shortage. Finally, secure data storage encourages the growth of bioeconomy by promoting collaboration among private companies, universities, and government agencies without the risk of data leakage. This can accelerate the development of new medicine, vaccine, and therapy while creating high-paying jobs.